All right, before we dive into this crazy story, do me a favor, subscribe and tell us where you're watching from. The emergency department at St. Matthew's Trauma Center carried a particular kind of quiet after midnight. Not calm. Not peaceful. It was the quiet that came from exhaustion. Fluorescent lights hummed above half-finished charts. Monitor tones rose and fell at steady intervals. Rain tapped against the ambulance bay doors in slow, cold bursts. Coffee cups sat scattered along the nurses' station, their heat long gone. Evelyn Shaw stepped through the staff entrance at 1:12 a.m. Technically, she had already been on shift for 12 minutes. Practically, the night had started hours earlier for everyone else. She moved through the locker room without announcing herself. Her badge still looked newer than most of the ones clipped to the scrubs around her. The plastic edges had not yet worn smooth. When she walked onto the trauma floor, conversations barely paused. Most of the staff already knew her reputation. Quiet. Careful. Too careful. The kind of nurse who looked like she was still learning how to move inside a trauma room. At the central station, the charge nurse wrote assignments across the whiteboard without looking up. Sure. Evelyn stepped closer. Your support tonight. She nodded once. Support meant everything that mattered, but nothing that anyone noticed. Supply checks. Hallway beds. Chart corrections. Transport. Equipment resets. It did not mean leading trauma cases. Across the station, the louder personalities had already gathered around the trauma bays. 2 residents reviewed imaging reports with quick, confident voices. A respiratory therapist wheeled a ventilator past them with practiced efficiency. That was the visible work. The work people talked about later. Evelyn turned toward the supply cabinets without another word. She opened the airway cart and began checking the drawers. Laryngoscope blades. Tube sizes. Battery charge. Everything moved through her hands slowly but precisely. Behind her, one of the residents glanced over. Dr. Palmer. 2nd year. Quick hands, faster opinions. He watched her inspect the equipment tray and gave a small shake of his head. You know respiratory already checked that, right? Evelyn slid one drawer open and verified the oxygen tubing alignment. Sometimes. Palmer leaned against the counter. You always do that. She closed the drawer and sealed it. Check things? He smiled faintly. Move like you're waiting for permission to breathe. A few of the nurses nearby laughed quietly. Palmer straightened and added, not unkindly but not gently either. You'll never survive trauma if you hesitate like that. Evelyn logged the seal number on the cart clipboard. She didn't answer. Palmer watched her for a moment longer before turning back toward the trauma board. The room continued moving around her. A monitor alarm chirped down the hallway. Evelyn glanced toward the sound. In room 6, an elderly patient had shifted in bed. One ECG lead had slipped loose, causing the monitor to complain in steady beeps. She stepped inside. The patient never woke as she pressed the adhesive pad back into place and rerouted the cable so it wouldn't pull again when he rolled. The alarm stopped immediately. Evelyn updated the chart and returned to the corridor. Near the medication cabinet, another nurse prepared an injection for a cardiac patient. Evelyn slowed as she passed. The vial on the counter caught her eye. The concentration printed on the label didn't match the dosage displayed on the computer screen. She leaned slightly closer. I think that vial is the concentrated version, she said quietly. The nurse looked down. Her expression shifted instantly. You're right. The syringe went into the disposal bin. A different vial came out of the cabinet. Good catch. Evelyn nodded once and stepped away before the moment grew larger. 10 seconds later, the medication went to the patient correctly. No one else noticed the correction, which was exactly the point. Across the trauma floor, the charge nurse closed a patient chart and finally looked up. Sure. Evelyn turned. If something serious comes in tonight, the nurse said, stay out of the way unless someone asks for help. The tone wasn't hostile, just practical. We've got enough chaos without someone freezing in the middle of a trauma. Evelyn held the nurse's gaze. I understand. The charge nurse studied her for a moment longer. Don't embarrass yourself trying to keep up. Evelyn nodded once. Okay. She turned back toward the equipment cart and continued resetting the supply trays. Across the room, Palmer and the other residents laughed about something over the imaging screen. The rhythm of the emergency department settled again. Monitor tones. Footsteps across tile. Rain tapping against the glass doors. Evelyn checked the blood refrigerator inventory and logged the expiration dates in neat handwriting. O negative. A positive. 2 units nearing replacement. She had just closed the refrigerator door when the overhead radio crackled. The sound cut cleanly through the department. Every head turned toward the speaker. Stand by for trauma alert. The room shifted instantly. Conversation stopped. The charge nurse stepped toward the center of the floor. Trauma team to Bay 1. Staff began moving quickly. Gloves snapped on. Ventilators rolled into position. Residents pulled gowns from the rack. Evelyn set the inventory log back on the counter. No one called her name. Support staff were rarely needed in the first moments of a major trauma. But as the room prepared the bay, the dispatcher's voice returned over the speaker. Priority inbound. Male patient. Severe thoracic trauma. Transport from Naval District perimeter. That phrase changed the atmosphere immediately. Naval District. Military involvement. Security protocols. The trauma team moved faster now. Evelyn stood quietly near the equipment cart, watching the room. Not nervously. Not curiously. Studying. Personnel positions. Equipment layout. Doorways. Angles. The quiet evaluation of someone who understood that chaos was easier to survive when you knew the room before it started. Rain continued striking the ambulance doors. The emergency department had been routine all night. But something about the incoming case had shifted the air. And somewhere beyond the storm outside, a wounded man was already on his way toward the trauma bay that Evelyn Shaw had just finished preparing. The ambulance door slammed open at 1:26 a.m. Cold rain pushed briefly into the ambulance bay before the paramedics forced the stretcher through the entrance. The quiet rhythm of the emergency department broke instantly. Male, early 40s, one of the paramedics called out as they rolled the gurney toward Trauma Bay 1. Severe thoracic trauma. Blood loss during transport. Hypothermic. The room came alive. Gloves snapped onto hands. A ventilator rolled forward. Monitors were pulled from the wall mounts and powered on. The patient lay rigid against the stretcher straps. Civilian clothing. Dark jacket cut open from the collar down. The fabric had already stiffened with drying blood. But nothing else about him looked civilian. Even through shock and cold, his body carried the kind of controlled tension that did not belong to ordinary trauma patients. His breathing was tight but deliberate, like someone forcing discipline into a failing body. 2 men followed behind the stretcher. Not hospital staff. Plain clothes. Hard posture. One stood just inside the trauma bay doors and did not move any farther. Security without uniforms. Dr. Halpern stepped to the head of the bed. Vitals. Pressure 80/40, the paramedic answered. Pulse 125. Temperature dropping. Mechanism. Blunt impact and possible penetrating injury. Found near the Naval District perimeter. The phrase hung briefly in the air. Naval District. Military territory. Halperin did not react outwardly, but the room tightened. "Let's move," he said. The trauma team surged forward. Scissors cut away the remaining fabric from the patient's torso. Gauze packed along his right side was already dark with blood. Respiratory adjusted the oxygen mask. A nurse connected the cardiac monitor. Across the bed, Evelyn moved quietly toward the equipment cart. She did not wait for instructions. Her hands lifted a pressure bag and connected it to the transfusion line. A second line of suction tubing was placed beside the tray. She checked the airway kit and pulled the correct endotracheal tube from the drawer. No one asked for any of it. But when Halperin glanced toward the tray, the equipment was already there. The room continued working around the stretcher. 2 large-bore 4s, Halperin ordered. One nurse stepped forward to secure the line in the patient's arm. Evelyn moved to assist. She slid beside the bed and reached for the pressure bag connected to the transfusion tubing. Her hands were steady, even if the rest of the room still saw her as the quiet nurse who moved too carefully. The patient's eyes opened. They moved across the room quickly. Not confused. Evaluating. They landed on Evelyn leaning over the line. For half a second he studied her face, her badge, the calm precision of her hands. Then his expression hardened. "Back away, nurse." The words came through clenched teeth. Not loud, but absolute. The trauma bay paused. Evelyn released the line immediately. No hesitation. No offense. She stepped back from the bed as if the command had always been expected. Halperin frowned slightly. "She's helping stabilize." I said back away. The patient's voice was weaker now but carried the same controlled force. Halperin exhaled through his nose. "Fine." He gestured toward another nurse. "Now, take the line." The replacement nurse stepped forward and grabbed the pressure bag Evelyn had already prepared. The moment passed quickly. To most of the room it meant only one thing. The patient did not trust the quiet nurse. Another sign that she did not belong near the center of serious trauma. Across the bay, Palmer gave a small shrug to one of the other residents. "Told you," he muttered quietly. Evelyn heard it. She did not react. She moved back to the equipment cart and checked the suction tubing again. The trauma team continued focusing on the obvious injury. The wound along the right side of the chest. Possible rib fracture, Halperin said. Internal bleeding likely. The ultrasound probe slid across the patient's abdomen. The screen flickered with grainy shapes under the fluorescent light. Evelyn stood 2 steps away. Watching. Not the screen. The patient. His breathing. The way the oxygen mask fogged with each inhale. Something about the rhythm felt wrong. Each breath came controlled but uneven. The right side of the chest moved slightly later than the left. Subtle. Easy to miss. The wound pack along the ribs looked tight. Too tight for the amount of bleeding visible. Her eye shifted to the patient's neck. The vein stood out faintly under the trauma lights. Another detail. Then she heard something else. The patient muttered under his breath. Not loudly. Not intended for the room. Just a single word spoken through pain. Evelyn froze internally for a fraction of a second. The word itself meant nothing to the rest of the team. But the way it was said carried weight. The clipped tone of someone trained to communicate under pressure. Her mind marked it without changing her expression. Across the bed, Halperin continued directing the team. Prep blood. Call surgery. Keep pressure on that pack. The room responded quickly. Volume. Speed. Movement everywhere. Evelyn picked up another suction catheter and placed it beside the tray. If the bleeding worsened, they would need it immediately. A resident noticed. Who asked for that? No one, she answered quietly. He shook his head. Stick to what's assigned. Evelyn nodded once and stepped back again. From the edge of the room, she watched the patient's breathing. The delay in the right lung expansion. The tension building along the wound pack. The words he had muttered. Pieces of a pattern forming beneath the obvious trauma the team was treating. But she said nothing. Not yet. Because the room still believed it understood the injury. And right now the quiet nurse who had just been ordered away from the bed would not be the voice anyone listened to. So Evelyn Shaw remained exactly where they expected her to be. Silent. Observing. Waiting. And noticing things no one else in the room had seen. The trauma bay settled into a rhythm that looked confident from the outside. Monitors beeped in steady intervals. The ultrasound probe moved across the commander's abdomen again while Dr. Halpern studied the screen with growing certainty. Positive fluid, the resident said. Halpern nodded once. Internal bleed. The diagnosis moved through the room quickly. Orders followed. Blood units were prepared. A surgical consult was requested upstairs. The team had a direction now, which meant the noise in the room grew louder. Volume always followed certainty. Evelyn stood near the equipment cart where she had stepped back earlier. From there she watched the bed without interrupting the circle of doctors working around it. The commander drifted somewhere between consciousness and shock. His eyes opened briefly, then closed again. His breathing came shallow through the oxygen mask. Each inhale controlled the way trained people force their bodies to keep functioning under pain. His skin had grown paler under the fluorescent lights. Hypothermia was setting in. The transfusion line continued feeding blood slowly into his arm. Across the bed, the resident adjusted the ultrasound probe again. Fluids increasing. Halpern glanced at the monitor. Let's get him upstairs before he crashes. The plan sounded clean. Obvious wound. Obvious treatment. Evelyn's eyes remained on the commander's chest. His breathing pattern had changed again. Each inhale began normally, but the right side of his chest hesitated. Just slightly. A small delay before the ribs expanded. Most of the room missed it. Evelyn did not. She watched the oxygen saturation reading. 90. Then 89. The drop was slow but steady. The commander shifted on the table. Pain forced a breath through his teeth. His head rolled slightly toward the side rail. And in that drifting space between awareness and shock, he spoke. Not loudly. Not to anyone in the room. Just a single word, muttered under his breath. Viper 2. The sound passed beneath the noise of the trauma bay. Most of the team never heard it. But Evelyn did. For a fraction of a second, everything inside her stopped. Her hands froze on the edge of the equipment tray. Her face did not change. But the word hit something buried far deeper than the hospital floor beneath her feet. Viper 2. Not a nickname. Not a random phrase. A call sign. British. Operational. Her mind recognized the cadence immediately. The clipped tone of a designation spoken inside a radio net where every syllable carried weight. The context around the word formed just as quickly. SAS liaison operations. Joint task teams. Field medicine under different command structures. The kind of world that did not exist anywhere near a civilian emergency room in Savannah. Evelyn lowered her eyes to the equipment tray. Slowly. Carefully. No one around her had reacted. which meant no one else had recognized the word. The commander shifted again, drifting deeper into shock. His breathing tightened further. The oxygen monitor dipped again. 87. Across the bed, Halperin continued focusing on the ultrasound image. Still fluid present. The resident nodded. That's our problem. But Evelyn's mind had already moved past the word. The call sign itself mattered less than the fact that he had spoken it. People did not say operational designations by accident, especially not while drifting in and out of consciousness. It meant something in his mind was still inside the mission environment he had come from, which meant the injury had likely occurred in a context the hospital team did not fully understand. Evelyn felt the weight of a decision pressing against her thoughts. She could answer the call sign. One sentence would be enough. A single phrase spoken correctly would tell him she understood exactly what world he came from. It would also expose something about her that no one in this room expected to hear from a rookie ER nurse. The trauma bay still saw her as support staff. Quiet. Careful. Not someone whose voice carried authority. If she spoke that language aloud, that invisibility would disappear instantly. Questions would follow. Attention. History she had worked very hard to bury. Evelyn inhaled slowly and let the moment pass. Silence was safer. For now. The commander shifted again, his breathing shorter with every cycle. Evelyn moved closer to the monitor. Not enough to interrupt the team. Just enough to watch. The oxygen saturation dropped again. 85. Her eyes traced the rise and fall of the commander's chest. Left side expanding normally. Right side lagging again. The wound pack along the ribs looked tight. Almost rigid. She studied the bandaging. Whoever had packed the wound in the field had done it fast. Efficient. But the compression along the rib cage looked heavier than necessary. Her gaze moved to the commander's neck. The veins were slightly more pronounced now. Subtle swelling under the skin. Another piece. Then she checked the blood pressure waveform on the monitor. The pulse pressure had narrowed further. Systolic falling. Diastolic creeping upward. The pattern did not match simple blood loss. Something else was building inside the chest cavity. Evelyn felt the pieces align quietly in her mind. Blunt trauma. Tight field packing. Delayed lung expansion. Rising pressure inside the chest. The room continued chasing the visible wound. But the real threat was somewhere deeper. And if it continued building the way she suspected, the commander would not make it to the elevator. Evelyn kept her face calm. Her hands moved across the tray as if checking supplies. Inside, her thoughts were already calculating. Timing. Evidence. The exact moment when silence would become more dangerous than speaking. For now, she remained the same person the room believed she was. The quiet nurse standing near the equipment cart. The one no one expected to understand the word the commander should never have said. The trauma bay moved forward under a single assumption. Internal bleeding. The ultrasound image had given the team something solid to believe in, and belief brought speed. Blood units were prepared. The surgical consult upstairs confirmed they were ready. A transport path to the operating floor was already being cleared. Dr. Halperin stood at the head of the bed, watching the monitor while the resident adjusted the probe again. Fluid still there, the resident said. Halperin nodded. Good. At least the diagnosis is clean. Clean meant predictable. Predictable meant control. Around the bed, the trauma team continued working with practiced efficiency. Respiratory adjusted the oxygen mask. A nurse replaced one of the blood bags as the first emptied. Another resident prepared a second transfusion line. Evelyn stood near the equipment tray where she had been since the patient ordered her away earlier. Her attention had never left the commander's chest. The breathing delay had become clearer. Each inhale came with the same hesitation on the right side. The oxygen saturation continued drifting downward despite the transfusion. 85. Then 83. Her gaze shifted to the neck again. The veins had swollen further beneath the harsh trauma lights. The pattern had passed suspicion now. It had become confirmation. Evelyn stepped closer to the bed. Not abruptly. Just enough to speak without raising her voice. "Doctor." Halperin didn't look up. Not now. Evelyn kept her tone level. The pressure drop doesn't match the abdominal bleed. Halperin turned his head slowly. "What?" She gestured toward the monitor. "The oxygen saturation is falling faster than the blood pressure." The resident nearest the ultrasound shook his head immediately. "That's expected with shock." Evelyn nodded slightly. "Yes." Then she pointed toward the commander's chest. "But the right lung expansion is delayed." Halperin's expression hardened. "We're not diagnosing lung injuries in the trauma bay." Evelyn spoke carefully. "I'm suggesting we check the chest cavity before transport." The room fell quiet for a moment. The interruption itself had weight. A rookie nurse correcting a trauma attending in front of the entire team was not something that happened often. Halperin crossed his arms. "Your support staff tonight." Evelyn held his gaze. "Yes." "Then stay in that role." His voice carried across the bay. "We have a working diagnosis and a surgical team waiting upstairs." Evelyn did not raise her voice. "I understand." Halperin gestured toward the ultrasound screen. "Then let the people trained to interpret this run the room." A few members of the team looked away from the exchange. The message was clear. Correction rejected. Conversation finished. Evelyn nodded once. Understood. She stepped back from the bed. Outwardly, the confrontation ended there. Inside her mind, nothing about the situation had changed. The commander's breathing remained uneven. The oxygen monitor dipped again. 81. She returned to the equipment cart without another word. Across the bed, Halperin resumed directing the team. "Prep transport in 2 minutes." The resident began securing the 4 lines for movement. Evelyn watched the room quietly. Then she began making small adjustments. She repositioned the suction tubing so it ran along the side rail instead of across the patient's chest. She shifted the oxygen line slightly higher on the mast so it would not interfere with the collarbone area. She moved the decompression kit from the back of the equipment tray to the front. None of the actions looked unusual. Each one appeared like routine preparation. But together they created something else. Space. Access. The exact positioning needed if the chest needed intervention in a hurry. Palmer noticed her moving the tray. "What are you doing?" "Organizing," Evelyn said calmly. "We're not doing chest work." "I know." She finished positioning the kit and stepped back again. Across the bed, the commander stirred. His eyes opened briefly. They moved across the room, unfocused at first. Then they stopped on Evelyn. Not on the doctors. "Olha." His breathing tightened again. The oxygen mask fogged with each shallow inhale. Something in his expression changed slightly. Recognition. Not of her face. Of her voice. The tone she had used when she spoke earlier. A calm that did not match the uncertainty of a rookie nurse. His gaze lingered on her for a moment longer before drifting away again. The oxygen monitor beeped. 79. Respiratory adjusted the flow rate. Halperin frowned at the numbers. That's not improving. The resident glanced at the screen. Maybe the bleed's worse than we thought. Evelyn watched the commander's chest rise again. Left side expanding normally. Right side lagging behind. Then the next breath came even shorter. The oxygen saturation dropped again. 76. The alarm changed pitch. The room stiffened instantly. Halpern looked at the monitor. That's sudden. The resident checked the blood pressure reading. 62. The commander's breathing became shallow enough that the oxygen mask barely fogged. Evelyn did not move. She had been waiting for this moment. The failure she expected had arrived exactly on schedule. Halpern turned toward the team. Why is the saturation dropping? Respiratory shook his head. Lungs aren't expanding properly. For the first time since the confrontation, Halpern looked toward the commander's chest instead of the ultrasound screen. The uneven movement became visible immediately. The delay. The tight expansion. The swelling along the wound pack. The room went quiet again. And suddenly the possibility Evelyn had mentioned only minutes earlier no longer sounded theoretical. Because the patient was deteriorating in exactly the way she had warned them he would. The oxygen alarm changed pitch. 74. Then 72. The trauma bay, which had been moving with confident momentum only seconds earlier, lost its rhythm. Respiratory leaned closer to the monitor. He's not ventilating properly. The resident checked the blood pressure again. 60. Dr. Halpern turned back toward the patient's chest for the first time with real concern. The uneven expansion was now obvious even to someone who had not been watching for it. The right side barely moved. The left lung rose and fell normally, but the right side lagged behind with each breath as if something inside the chest was holding it down. Halpern frowned. That's not good. The certainty from earlier had vanished. The ultrasound machine, the abdominal bleed diagnosis, the plan for surgery upstairs, all of it suddenly felt less solid. The room hesitated. Only for a moment. But the hesitation was enough. Evelyn stepped forward. Not dramatically. Just one step closer to the bed. Decompression tray, she said calmly. Her voice did not rise. It did not carry panic. It sounded like a practical instruction. The nurse standing beside the equipment cart looked down at the tray. It's here. Bring it closer. The tray slid across the counter toward the bed. Evelyn's hands reached for the catheter and alcohol swab before anyone formally gave permission. Across the bed, Halpern still watched the patient's chest. Pressure. 58, the resident answered. The oxygen monitor dropped again. 69. Respiratory looked toward Halpern. Doctor. Evelyn spoke again, slightly firmer. Needle decompression. Halpern turned toward her. For half a second the earlier confrontation returned to his face. But the monitor alarm cut through the room again. 67. Halpern stepped aside. Do it. Evelyn moved immediately. The hesitation that had followed her all night vanished the moment the decision became life or death. Her hand stopped shaking. The alcohol swab cleaned the insertion point between the ribs. The catheter aligned precisely with the space she had already prepared earlier. She inserted the needle. The trauma bay held its breath. For a fraction of a second nothing happened. Then the air burst out with a sharp hiss. The sound filled the room. Trapped pressure escaping from inside the chest. The commander's next breath came deeper. The right lung expanded slightly for the first time since he had arrived. The monitor numbers responded almost instantly. 70. Then 73. The respiratory therapist leaned toward the screen. That's improving. Evelyn removed the needle and secured the catheter in place. The hiss softened but continued in quiet bursts with each exhale. She stepped back slightly. Blood pressure. "65, the resident answered. The oxygen saturation climbed slowly. 78. The immediate crisis had shifted. But the room was no longer moving the same way. The hierarchy had fractured. For the first time since the trauma began, the loudest voice in the room was not directing the sequence. Evelyn spoke again. Another unit of blood. The nurse beside the transfusion line swapped the bag automatically. Evelyn pointed toward the suction tubing. "Keep that clear." Respiratory adjusted the oxygen mask. Halpern watched her carefully now. Not arguing. Not correcting. Just watching. The resident beside him frowned slightly. He had noticed something. Earlier in the shift, Evelyn had moved cautiously, almost apologetically. Now her movements were precise. Economical. Not rushed. Not hesitant. Like someone who had done this before under conditions where hesitation meant something worse than embarrassment. The resident leaned closer to the respiratory therapist. "Have you noticed that?" The therapist kept his eyes on the monitor. "Yeah. That's not rookie behavior." Evelyn checked the commander's chest again. The right lung expanded more evenly now, but the breathing remained strained. The oxygen climbed to 82. Better, but still unstable. She pointed to the monitor again. "Pressure bag back on the line." The nurse inflated the bag. Fluid moved faster through the four. The blood pressure rose. 70. The commander's eyes opened briefly. This time they found Evelyn immediately. No confusion. No dismissal. Just focus. He watched her face the way wounded soldiers watched medics on a battlefield, looking for the one person who seemed to know exactly what came next. Across the bed, Halpern finally spoke. "What else?" Evelyn met his eyes calmly. "Stabilize circulation." Then she added, without raising her voice, "Prepare for secondary collapse." The resident blinked. "Secondary collapse?" Evelyn nodded toward the monitor. "The pressure spike won't hold." The words were simple, but the tone carried something different now. Not academic theory. Operational expectation. The kind of statement someone made after seeing the pattern before. The respiratory therapist glanced toward her again. That cadence. Short instructions. Direct sequencing. He had heard something like it before. Not in hospital training. Somewhere else. He leaned closer to the resident and spoke quietly. "She sounds military." The resident looked back at Evelyn. She was already preparing the next step, adjusting equipment and checking the monitors as if the room had always belonged to her. And the commander on the bed had not taken his eyes off her since the moment she saved his lung from collapsing. The numbers on the monitor held for less than a minute. The decompression had relieved the pressure in the chest, but the commander's body was still fighting shock. Blood loss, cold exposure, and the stress of the injury pressed against the fragile stability Evelyn had created. The oxygen monitor flickered between 81 and 83. Not good, but survivable. Then the commander's breathing changed. His eyes snapped open. Wide. Not confused. Alert in the way people sometimes became when pain broke through sedation and adrenaline at the same time. His hand moved suddenly toward the fall line. "Hold him," one of the nurses said. The commander jerked his arm away. The foot tubing stretched dangerously. The blood bag swung. Respiratory stepped closer. "Sir, stay still." The commander's gaze moved across the room quickly. The trauma bay. The people surrounding him. Bright lights. Hands. Equipment. His breathing accelerated again. Short. Sharp. Cornered. His body tried to sit up. The movement sent a ripple of alarms across the monitors. "Easy," Halpern said sharply. "You're injured." The commander shoved weakly against the side rail. "Get off me." The oxygen mask slipped sideways as he struggled. One of the residents grabbed his shoulder. "Sir, stop moving." The commander reacted instantly. Even weakened, the movement carried trained instinct. His arm twisted free, knocking the resident's hand aside. For a brief second, the trauma bay lost control. Lines pulled tight. The oxygen mask dropped halfway off his face. The decompression catheter shifted dangerously near the rib cage. Respiratory stepped forward again. "If he pulls that line out..." Halpern raised his voice. "Sedate him." But the moment had already become dangerous. More hands moving toward the patient only made the situation worse. The commander's eyes darted from face to face. No trust. No recognition. Just the reaction of someone who had woken inside a room full of strangers touching his body. The more the team tried to restrain him, the more violent the movement became. The monitor screamed. 76. The catheter at his chest shifted again. One wrong pull and the fragile decompression would fail. Evelyn stepped forward. Not quickly. Not forcefully. Just enough to stand within the commander's field of vision. "Stop," Halpern snapped at her. "He's not responding to commands." Evelyn ignored the instruction. She leaned slightly closer to the bed. The commander's eyes locked onto her. Not recognition yet, but attention. The room was still shouting instructions around them. "Hold his arm." "What's the line?" "Get the sedative ready." Evelyn spoke quietly. Not to the room. To him. "Viper 2. The word landed between them like a stone dropped into still water. The commander froze. Not completely. His breathing still strained. But the fight stopped. His eyes sharpened instantly. Focused. Locked onto her face. The room fell silent. Halpern looked from the patient to Evelyn with visible confusion. The resident holding the syringe paused. No one in the trauma bay understood what had just happened. The commander stared at her. For one long second, neither of them spoke. Then Evelyn said the second phrase. Soft. Precise. Blue channel secure. The words were simple, but the structure was unmistakable. Operational language. The kind used between people who had once communicated through radios instead of voices. The commander's shoulders lowered slightly against the stretcher. Not relaxed, but controlled. His breathing steadied enough for the oxygen mask to be repositioned. The fight had disappeared. Not because he trusted the room, because he recognized something in her voice. Halpern stared at Evelyn. "What did you just say?" Evelyn did not answer him. Her attention remained on the commander. "Stay still," she said quietly. Not as a command, as a shared understanding. The commander's eyes never left her face. He gave a small nod. Once. The trauma bay remained frozen for another moment. Respiratory finally stepped forward and adjusted the oxygen mask again. The catheter at the commander's chest settled back into place. The monitor climbed slowly. 80. The resident lowered the unused sedative syringe. Halpern looked around the room, then back at Evelyn. "Explain." She didn't. Instead, she pointed to the transfusion line. "Next unit ready." The nurse nodded automatically. Evelyn adjusted the pressure bag herself. "Run it steady." The blood pressure monitor flickered. 72. Then 75. The commander remained still now. His eyes followed Evelyn as she moved around the bed. When Halperin spoke again, his voice had lost some of its earlier certainty. How did you calm him? Evelyn checked the oxygen saturation. Focus. Halperin frowned. That wasn't a guess. Evelyn didn't respond. She turned to the respiratory therapist. Keep the airway clear. The therapist nodded. For the first time since the trauma began, the room had accepted her instruction without hesitation. Because the patient, the man everyone had struggled to control only seconds earlier, was now completely still, listening only to her. The commander's gaze remained fixed on Evelyn. And from that moment forward, whenever another voice in the room gave an order, his eyes did not move. Only when Evelyn spoke did he react. Which meant something inside the trauma bay had shifted permanently. The loudest doctor in the room was no longer the person the patient trusted. The quiet nurse standing beside the bed was. For nearly a minute, the trauma bay held together. The commander remained still under the oxygen mask. The decompression catheter continued venting small bursts of air with each controlled breath. Blood flowed steadily through the transfusion line. The monitor numbers hovered just high enough to suggest survival. 78. 81. Not strong, but stable. The room had regained its rhythm. Respiratory checked the airway again. A nurse replaced the empty blood bag with another unit. Dr. Halperin stood at the head of the bed reviewing the ultrasound screen once more, as if reclaiming control through routine. Evelyn remained beside the stretcher. The commander's eye still followed her movements, but he no longer struggled. For a moment, it looked like the crisis had passed. Then the heart rate spiked. 120. 130. The oxygen monitor dipped. 79. The respiratory therapist leaned closer to the screen. That's not good. Evelyn saw it before anyone else said the words. The commander's breathing had changed again. Not the uneven lung expansion from earlier. This was faster. Shallower. The pattern of a body falling back toward circulatory collapse. The blood pressure flickered. 72. Then 68. The monitor alarm shifted pitch again. The trauma bay tightened instantly. Halperin looked at the screen. What now? The resident checked the fall line. Blood still running. Respiratory adjusted the oxygen mask again. No obstruction. But Evelyn had already moved her eyes from the monitor to the patient's skin. A thin sheen of sweat had appeared along the commander's forehead. His fingers twitched against the stretcher rail. The breathing rhythm was wrong. Not lung failure. Not blood loss. Something deeper. She checked the ultrasound screen again. The heart's movement looked strained. Not compressed like before. Restricted. Halperin frowned. We stabilized the chest. The resident nodded. That should have solved the collapse. But the monitor continued falling. 65. The commander's breathing shortened further. The fragile stability Evelyn had created was beginning to unravel. Halperin's voice sharpened. What changed? No one answered immediately, because the answer wasn't obvious. The ultrasound still showed fluid. The chest decompression still held. The blood transfusion was running correctly. Everything the room had already done should have been working. Halperin glanced toward Evelyn. His expression tightened. Unless our earlier intervention created a new problem. The implication landed heavily. The decompression had been her call. If the patient crashed now, the responsibility would be easy to assign. The resident beside him spoke carefully. Maybe the needle decompression wasn't necessary. Halperin folded his arms.
That's possible.
The room went quieter. Not openly accusing, but the shift in tone was clear. The quiet nurse who had taken control minutes earlier had become the easiest explanation if things went wrong. Evelyn didn't react. Her attention remained on the patient's breathing. The commander's eyes opened again briefly. Still focused. Still aware. He looked at her. Not frightened. Just waiting. Across the room, the trauma bay doors opened. A woman stepped inside wearing a dark coat over hospital scrubs. Dr. Lauren Caldwell, Chief of Emergency Operations. Administrative oversight rarely appeared in active trauma rooms. But the combination of a naval district injury and a destabilizing patient had already triggered internal alerts. Caldwell's eyes moved quickly across the room. The monitors. The staff. The wounded man on the table. What's the situation? Halperin answered immediately. Complex trauma. Stabilization attempt underway. His tone carried a subtle edge. Controlled. Professional. But defensive. Caldwell's gaze shifted toward Evelyn, the quiet nurse standing closest to the patient. The one the commander still watched more closely than anyone else. The monitors beeped again. 62. Evelyn felt the pressure building in the room. Not just medical now. Political. Every movement in the trauma bay carried more weight when hospital leadership stood in the doorway. Her earlier intervention had already drawn attention. The words she had spoken to calm the commander had drawn even more. If she continued stepping forward, the questions that followed would not stay inside this room. She could step back. Let the attending reclaim full control. Let the hierarchy run the sequence the way it expected to. If the patient crashed, responsibility would fall neatly along the chain of command. Her anonymity would remain intact. But Evelyn looked at the commander's chest again. The breathing pattern had reached the point she feared. The heart rate climbed. 140. The blood pressure dipped. 59. Transporting him upstairs in that condition would finish the collapse. The room still hadn't identified the deeper problem. Evelyn inhaled slowly, then spoke. Doctor. Halperin turned toward her with visible impatience.
What?
Evelyn pointed toward the ultrasound screen. The heart isn't failing. Halperin frowned, then explained the drop. She gestured toward the 4 line. The circulation is losing balance. The resident blinked. What does that mean? Evelyn kept her voice calm. Fluid distribution shift after decompression. The room stared at her. The phrase sounded unfamiliar to several of the staff. Halperin's tone sharpened. That's not standard trauma protocol. Evelyn nodded slightly. No. Then she met his eyes. It's a field response. The words hung in the air. Respiratory looked at the monitor again. The blood pressure dropped another point. 58. Evelyn continued. There's a maneuver that can rebalance pressure long enough to stabilize circulation. Halperin crossed his arms. And you learned that where? Evelyn didn't answer the question. Instead, she pointed to the pressure bag attached to the blood line. Half volume. Controlled compression. The resident frowned. That's risky. Evelyn nodded. Yes. She didn't defend it. Didn't dramatize the decision. She simply finished the thought. But it will keep him alive. The trauma bay fell silent again. The monitors continued beeping softly. And the commander on the stretcher still watched Evelyn Shaw as if she were the only person in the room who knew exactly what came next. The monitor dipped again. 57. The room felt the number before anyone spoke it out loud. The commander's breathing had shortened further. Each inhale came shallow and tight beneath the oxygen mask. The The decompression catheter continued venting air from the chest, but the circulation was collapsing again beneath the surface. Dr. Halperin stared at the monitor. That's not shock alone. The resident checked the fall line again. Blood is still running. Respiratory adjusted the oxygen mask. Airways clear. The problem was no longer obvious. The room had exhausted the explanations it understood. Evelyn stood beside the bed with the pressure bag still in her hand. The commander's eyes had not moved from her since the moment she spoke the call sign earlier. He was not calm because the room was calm. He was calm because she was. Evelyn looked at the monitor again. 55. Then she spoke. Half-volume transfusion. The nurse beside the fall line hesitated. Halperin turned toward her. That won't correct the pressure drop. Evelyn nodded slightly. Not alone. The room waited. She placed the pressure bag gently on the line. Controlled thoracic compression. The resident blinked. You want to compress the chest. Evelyn kept her tone even. Temporarily. Halperin's jaw tightened. That is not standard trauma care. Evelyn did not argue. She simply explained. When decompression releases pressure too quickly, circulation can destabilize. The respiratory therapist glanced at the monitor again. 53. The oxygen saturation dipped. 72. Evelyn continued. Compression restores balance long enough for the heart to recover output. Halperin folded his arms. And you learned this where? Evelyn met his eyes for half a second. Field medicine. The words were not dramatic. Just factual. The room understood what that meant without her explaining further. This was not something taught in hospital training. Halperin exhaled slowly. And if it fails? Evelyn answered without hesitation. Then it fails. She did not soften the sentence. Did not justify it. Just accepted the responsibility. The commander shifted slightly on the stretcher, still watching her. The monitor dropped again. 52. Caldwell stood near the doorway, silent but attentive. The administrator had not intervened. But the weight of her presence pressed against the room. Halperin looked at the monitor again. Then at the patient. Then back at Evelyn. Do it. The permission came quietly. Evelyn moved immediately. Her hand slid into position along the commander's chest and upper abdomen. Not forceful. Not rushed. Precise. The pressure bag inflated beside the fall line. Half volume, she said. The nurse adjusted the flow. Evelyn inhaled once. And the memory returned. Not as images. As muscle memory. Dust in the air. Rotor blades in the distance. Field stretchers under harsh lights. A wounded soldier breathing through blood and cold. She pushed the memory away. This was not that place. But the technique belonged to the same world. On my count, she said. The respiratory therapist leaned closer to the monitor. The room fell silent. Evelyn began the controlled compression. 1, 2, 3. Her hands moved in steady rhythm against the commander's chest. Not CPR. Not forceful pressure. Measured. Disciplined. The pressure bag forced fluid into the line. The monitor flickered. 55. Then 58. Respiratory glanced at the screen. It's moving. Evelyn did not stop. Her breathing matched the rhythm of her hands. 4. 5. 6. The blood pressure climbed again. 62. The oxygen saturation rose. 76. The commander's chest expanded deeper with the next breath. His skin color improved slightly beneath the fluorescent lights. Halpern leaned closer to the monitor. "Hold there." Evelyn slowed the compression. Pause fluid. The nurse adjusted the line. The numbers steadied. 68. 70. The room remained silent for another moment. The maneuver lasted less than a minute. When Evelyn finally stepped back, the monitor held. 72. Not strong, but stable enough. Respiratory exhaled quietly. That worked. No one else spoke. Halpern stared at the monitor again. Then at Evelyn. The resident looked between them. The procedure had not come from hospital training. No one in the room had suggested it. No one had even recognized the pattern that required it. Evelyn wiped her hands with a sterile cloth and set the pressure bag down. The commander's breathing had steadied again. His eyes moved toward her. He gave a faint nod. The room felt different now. Not loud. Not triumphant. Just aware. The quiet nurse standing beside the stretcher had stabilized a patient twice in less than 15 minutes. Using techniques the rest of the trauma team had never been taught. Halpern finally spoke. "Prepare for transport again." But his voice carried less authority than it had earlier in the night. Because the hierarchy inside the trauma bay had shifted. Not through argument. Through evidence. The staff understood something now that had been invisible when the shift began. The rookie nurse they had dismissed as hesitant had not been guessing. She had been operating from experience earned somewhere far outside the walls of St. Matthew's Trauma Center. And in the most critical moments of the night, that experience had been the only thing keeping the commander alive. The monitors held. Not perfectly, but long enough. 74. Then 76. The numbers moved within a narrow range that suggested survival instead of collapse. The decompression catheter still released small bursts of trapped air with each controlled breath. Blood continued flowing through the transfusion line at a steady pace. For the first time since the ambulance doors opened, the trauma bay felt stable. Fragile, but stable. Dr. Halpern studied the monitor for several seconds before nodding toward the transport team waiting near the doorway. "Move him." The order carried less force than earlier commands. The urgency remained, but the edge of certainty had faded. Two nurses stepped forward to secure the 4 lines and pressure bag. Respiratory repositioned the oxygen mask while another staff member adjusted the stretcher height. The commander's eyes opened again briefly. He looked at Evelyn first. Not the surgeon. Not the team. Then the gurney began moving toward the trauma bay doors. The transport team pushed the stretcher into the hallway, the wheels rattling softly across the tile floor as they disappeared toward the elevators that led to the surgical wing. The door swung shut behind them, and the trauma bay became quiet. Not peaceful. Just empty in the way rooms felt after the center of gravity left them. The fluorescent lights hummed overhead. A discarded wrapper lay near the floor beside the 4 stand. One nurse removed her gloves slowly and dropped them into the bin. Another leaned against the counter and exhaled. No one celebrated. No one clapped. There was only a lingering stillness that followed a situation everyone understood had nearly ended differently. Evelyn picked up the wrapper from the floor and placed it in the trash. A small task. Routine. The kind of work she had been doing all night before the trauma arrived. Across the room, the resident who had mocked her earlier avoided looking in her direction. Respiratory reset the ventilator and glanced briefly toward her before returning to the equipment. Dr. Halpern remained near the head of the empty stretcher. For a moment he did not move. Then he removed his gloves slowly and placed them on the tray. "Sure." Evelyn looked up. "Yes, doctor." The room had mostly cleared now. Only a few staff remained within earshot. Halperin hesitated. His posture still carried the authority of the trauma attending, but the confidence behind it had shifted. You handled the decompression and stabilization well. The sentence came out carefully, as if he had practiced the wording before speaking. Evelyn nodded once. Thank you. Halperin looked toward the hallway where the patient had been taken. I may have misjudged the sequence earlier. The admission was incomplete, but it was as close to an apology as his pride allowed. Evelyn did not make the moment larger than it needed to be. You were managing the room, she said calmly. Halperin studied her expression. She had not corrected him, had not reminded him of the earlier confrontation. She simply returned the moment to the practical reality of trauma care. Halperin gave a small nod. Then he turned and walked out of the bay. The rest of the team drifted away soon after. Within minutes, the trauma room looked the same as it had before the ambulance arrived. Equipment reset. Monitors silent. The faint smell of antiseptic lingering in the air. Evelyn finished cleaning the decompression tray and sealed the instrument container. She had just stepped into the hallway when the elevator doors opened again. The transport team rolled the commander past on the way to surgery. For a moment, the stretcher slowed near the trauma bay entrance. The commander's eyes opened slightly. The oxygen mask covered most of his face, but his gaze moved immediately toward Evelyn. He studied her quietly, not as a patient looking at a nurse, as someone confirming something he already understood. You answered it correctly, he said through the mask. His voice was weak but steady. Evelyn knew what he meant. The Callsign. The phrase she had spoken earlier. She nodded once. That was enough. The commander watched her for another moment. You weren't supposed to be here. Evelyn didn't respond. He exhaled slowly. Neither was I. The stretcher began moving again. Before the elevator doors closed, he lifted 2 fingers slightly from the side rail. Not a wave. A signal. Recognition. Evelyn returned the smallest nod. The door slid shut. The moment ended. The hallway fell quiet again. Evelyn stepped into an empty corridor beside the trauma bay and leaned briefly against the cool wall. Her hands trembled. The steadiness she had held through the entire emergency finally loosened once no one was watching. The maneuver. The cadence of the instructions. The call sign. All of it had come from a world she had buried long before she ever stepped into a hospital uniform. For a few seconds she closed her eyes. Not to rest. To steady the memories that always returned when those skills surfaced again. Rotor noise. Dust. Field lights. Wounded bodies carried across stretchers under open skies instead of fluorescent ceilings. She inhaled slowly, then opened her eyes again. The hallway returned. Clean floors. Hospital lights. A place where the quiet nurse named Evelyn Shaw could remain exactly what everyone believed she was. She straightened, pushed away from the wall, and walked back toward the trauma bay. The night shift still had hours left. And there were other patients who needed a nurse who moved carefully enough to notice the things no one else did. The first hint of dawn arrived slowly. Not through sunlight. Through the way the hospital changed. The fluorescent light still burned above the trauma floor, but the rhythm of the night shift had begun to loosen. The emergency department moved differently in the hour before sunrise. The urgency softened into tired routine. Charts were handed over. Coffee was replaced. New staff drifted in through the employee entrance with quiet greetings and subdued voices. Evelyn Shaw stood at the nurse's station finishing the final notes from the trauma case. Her handwriting remained steady. Precise. No unnecessary commentary. Just the facts of the treatment sequence and the stabilization that allowed the patient to reach surgery alive. She signed the chart and closed the file. Behind her, 2 nurses from the incoming shift spoke quietly near the supply cabinet. That was the Naval District trauma, right? Yeah. I heard the patient almost coded in the bay. Someone said the decompression came at the last second. The conversation stayed low. Rumor moved through emergency departments the same way it moved through every hospital. Quick. Fragmented. Half facts. Half speculation. Evelyn carried a tray of fresh saline bags past them without slowing. Neither nurse stopped her. But one of them watched her a little longer than expected. The story had already begun forming. A complicated trauma. A difficult patient. A stabilization sequence that didn't follow the usual pattern. But the details remained unclear. Because the person who understood them best had given no one anything to repeat. Evelyn replaced the saline bags in the supply rack and updated the inventory sheet beside the cabinet. Small tasks. Routine work. Across the floor, the elevator doors opened. Dr. Lauren Caldwell stepped out. The Chief of Emergency Operations moved through the department with the quiet authority of someone used to being noticed. She stopped near the nurse's station when she saw Evelyn walking back toward the corridor. Sure. Evelyn turned. Yes, doctor. Caldwell studied her for a moment. The look was not clinical. It was evaluative. I reviewed the trauma report. Evelyn waited. The intervention sequence in that room was unusual. Evelyn nodded once. Yes. Caldwell folded her arms loosely. You recognized the pattern quickly. Evelyn did not answer the observation. Caldwell watched her for another second. There are departments in this hospital that would be interested in someone with that level of experience. The offer was careful. Not an accusation. Not a direct question. Just an opening. Evelyn understood it immediately. A pathway. A chance to move upward. Closer to leadership. Closer to the kind of work that would draw attention instead of avoiding it. She shook her head slightly. I'm comfortable where I am. Caldwell raised an eyebrow. That's not an answer many people give. Evelyn met her eyes calmly. I know. Caldwell studied her expression a moment longer. Then she nodded. Very well. She turned toward the elevator again. Before the doors closed, she added quietly, if that world ever comes looking for you again, the hospital will want to know. Evelyn said nothing. The elevator door slid shut. The hallway returned to its normal noise. Across the trauma floor, the ICU nurse from upstairs stepped out of another elevator and approached the station. Sure. Evelyn looked up. Yes. The commander from last night asked if you were still here. Evelyn hesitated only briefly. Is he stable? For now. She nodded. Okay. The ICU room was quieter than the emergency department. The machines hummed steadily beside the bed. The commander lay propped slightly upright, pale but conscious. His eyes moved toward Evelyn as she entered. For a moment neither of them spoke. Then he nodded once. Pressure held. Evelyn checked the monitor. Yes. He studied her face carefully. You answered the call sign without hesitation. Evelyn adjusted the oxygen line slightly. It was enough to calm you. That's not why. She looked at him. He held her gaze. You knew exactly what it meant. Evelyn said nothing. The silence stretched between them. Finally, he exhaled slowly. Most people who leave that world don't manage to stay gone. Evelyn checked the 4 line and tightened the clamp. And not most people. The commander gave the faintest hint of a smile. No. He lifted his hand slightly from the blanket. Not a salute. Not a gesture meant for anyone else in the room. Just a small acknowledgement. Thank you. Evelyn nodded once. Then she turned toward the door. The hallway outside the ICU had already filled with the movement of the morning shift. Doctors reviewing charts. Stretchers rolling past. Phones ringing from the central desk. The hospital had returned to its normal rhythm. Evelyn walked back toward the emergency department without anyone stopping her. In room 12, a patient stirred restlessly beneath a thin blanket. Evelyn stepped inside. The patient's breathing had become uneven during sleep. She lifted the blanket slightly and adjusted it across his shoulders. Her hands moved with the same calm precision they had shown in the trauma bay hours earlier. Steady. Controlled. Quiet. The patient's breathing slowed almost immediately. He settled back into sleep. Evelyn dimmed the light and stepped out of the room. The corridor continued moving around her. Doctors. Nurses. Patients. No one looking twice. No one asking questions. Within seconds she blended back into the flow of the hospital. Just another nurse beginning another long shift. And as the pale light of morning crept through the high windows of St. Matthew's Trauma Center, Evelyn Shaw disappeared once again into the fluorescent quiet where she had always preferred to remain.